So Bismillahirrahmanirrahim. This video is actually going to be a introductory video about the paranasal sinuses. First of all, they are air-filled spaces and they are located in our bones. The face, it is made by the bones that are frontal, maxillary, sphenoid, ethmoid. So in these bones, there are certain air-filled spaces like this, and these air-filled spaces are known as paranasal sinuses because they are surrounding the nose. Also, they are lined on the inside by the mucous membrane, and all of them they are going to open into the nasal cavity in its lateral wall. The nasal cavity, like this, it is the nasal cavity and it has this lateral wall. In the lateral wall of the nasal cavity, all of these sinuses are going to open, and the opening of a sinus into the lateral wall of the nose, it is known as the ostium. Also, function of the sinuses is majorly to make the skull lighter because they are filled with air, so they are going to make the skull lighter. Then they are going to warm up the air that is coming in the nose, so warming up is provided by these paranasal air sinuses. After that, they are going to humidify or fill the air with water. So what they are going to do, first of all, they are going to make the skull lighter because they are air filled. They are going to humidify or make the air filled with the water droplets, and then they are going to also warm up the air. Also, because these are air filled spaces, and whenever we are taking some air in, they are going to produce resonance. So the resonance in the voice is due to the presence of these paranasal air sinuses. Now these sinuses, whenever you are born, they are rudimentary, they are not well developed, but they will develop around 6 to 7 years of age, and after puberty they are in their maximum size. And why do they grow? These sinuses grow because of the enlargement of the bones. But in the early life, from birth to adult life until the maximum size, the sinuses are growing because of the growing of the bones. But in the old age, why are the sinuses growing? Because of the resorption of the bones. So in before puberty, they are growing because of enlargement of the bones, and after puberty they are growing because of the resorption of the cancellous bone. Let us see how many sinuses we have and wherever they are located. So in this video, you can clearly see in this diagram that where are these sinuses located. So first of all, you need to have a look at this one sinus which is located in the frontal bone. It is known as the frontal ear sinus. This sinus which is located in the ethmoid bone, it is known as the ethmoidal ear sinus, which is further divided into anterior, middle and posterior one. And this sinus located in the sphenoid bone, it is known as sphenoidal ear sinus. Whereas this sinus, which is located just above the alveolar process of the maxilla, it is known as the maxillary sinus. So there are four: frontal, ethmoidal, sphenoidal, and then the maxillary air sinus, and which are going to open into the lateral wall of the nose through openings which are known as ostium. And we will see the ostium when we will discuss each and every sinus. Now let us discuss our first sinus in the next video, that is the frontal ear sinus. Let's move on to that.